back. I'm bored as fuck, as you can tell. Musa said he was gonna call me back, so I'm just waiting for him to call. And knowing my luck, he's gonna call me during this video because that's what's been happening so far. But I'm bored as fuck, so I figured I'd talk to you guys until he calls me back, or if he calls me back, because I don't know. But yeah, this shit hurts. This is, I mean, I've never experienced something this bad, and and I always thought like grown adults got this, like not 20-year-olds, but like 30-year-olds or 40-year-olds and 50-year-olds, because growing up, I used to like watch my parents kind of go through it. So I always thought like when I was in my 40s and 50s that I was going to experience this, but I guess you can get it when you're in your 20s too. I mean, it's just a thing, like I guess you get it when you are an adult. It doesn't matter how old you are. But shit hurts. Like right now, it feels like there's a lump in my throat, but according to Google, that's normal for people that have acid reflux. It's like what is it called? There's a special name for it, and it happens when you have acid reflux. It's this weird, I don't know. But I'm drinking a glass of milk. Because it feels so good going down my throat, except for when it hits the lump. Um, but yeah, so it's just, I think, honestly, I think I have more than acid reflux because I Googled all of my symptoms, which my mom tells me not to do, but, I don't like going to the doctor for, like, stupid stuff, you know what I'm saying? Like, I don't like going to the doctor if I have an ear infection, mainly because, one, I have Kaiser. Two, and I'll tell you why I said the Kaiser thing, because there's this advice nurse line, and I've had ear infections since I was a little kid. So, like, I know what it feels like. So, I'm not about to go sit in an office, go see the doctor, have him put a thing in my ear, tell me it's infected when I already know it's infected. You know what I'm saying? Like, I'm not trying to do that just for medication when I can call the advice nurse and be like, I have an ear infection. And she'll ask me questions. She won't just give me a prescription. She'll ask me questions to make sure. And if she thinks it's an infection, then she'll prescribe it to me. So, um, um, so I Googled my symptoms, and this thing called GERD popped up, which is gastroesophageal reflux disease. Basically, do you know how there's your stomach, right? And then there's like that tube, the esophagus, where the food goes down into the stomach. So while your food is digesting, it's supposed to close and like it's supposed to relax and close. And what happens is it malfunctions and it opens, and then the bile comes up, and um, and you get all these symptoms. And a lot of people, it says you can have it without having heartburn, which makes a lot of sense for my case because there are times where I get chest pain and I've never like realized why, because I'm freaking 21 years old. You know what I'm saying? Like for a 21-year-old to have chest pain, I don't know. But then, like I have it and it goes away. So to know that it could be this is interesting. Um, there's even a surgery that you can get, but I don't think I need surgery. But you know, I'm gonna monitor, how often it happens, and if it happens more than twice a week, because I think it said more than twice a week is considered GERD. So if it happens more than twice a week, then I know for a fact it's GERD. But I wonder if that counts as GERD if it's not like your body doing it, but the medication that I'm taking, because my medication gives me heartburn. It gives me acid reflux. So do I really have a disease because my medication is giving me a disease? Like, I've never really understood that. But yeah. But I swear to God, you guys, it was getting so bad. Like, low key, I was going like this because I thought for sure I was gonna like throw up. Not like, okay, I wasn't like, I didn't think for sure I was gonna throw up, but it was like I could feel it up here and it was like freaking me out. And so I would open my mouth hoping to get like some air to come out. Maybe it was air, but like nothing. Because it feels like air bubbles. Um, Sorry, I don't mean to make a bunch of videos about this, but like I'm new to the whole acid reflux thing. Like, I mean, I'm not new to it because I've had it happen before, but never this bad. Um, so I'm definitely not going to be drinking a lot of coffee, which is it's sad because I've never had that problem before. But now I know why I get like sore throats a lot, maybe. But yeah. So I'm hoping it's something serious. What the fuck? Apparently, what I experience and what my dad experiences are two different things, which kind of concerns me because um, maybe I do have a true issue. My throat actually hurts really bad right now. Like, it doesn't feel like a sore throat. It legit feels like I wish I could, like, describe it to you. I don't know. Like,
Hello, I am Dr. Satish Babu, Senior Consultant, ENT, Head and Neck
Babu.
Surgeon, working with the Apollo Hospitals, Bangalore.
That sucks. Are you serious?
The causes are mainly emotional stress or acid reflux. So if we control these two effectively, then definitely this symptoms of lump in the throat will disappear quickly. Now, controlling the emotional stress is in our hands. Whereas if there is a significant acidity, then we can definitely take the help of medicine. Some simple medications like omeprazole or pantoprazole can be used regularly for up to 4 to 6 weeks. Generally, we give along with reducing the spice content, masala content in your food, and making sure that your food habits are regular. And consuming a lot of liquids in general will again help. Um, Curd is one of our prime anti-acidity measures, where it is the best naturally occurring neutralizer for the acid in the stomach. So if you are able to consume a lot of curd in any form, then it is definitely beneficial, right? Making sure that you eat on time, so that the acid that is produced during the 3 bulk meal times is effectively neutralized, and it doesn't come up into the chest, causing the lump sensation in the throat. And not thinking about it, not looking for the symptom. Like generally, if you have a lump sensation in the throat, we tend to swallow our own saliva regularly to see if that sensation is still persisting. That actually worsens the situation. Along with that, when you're swallowing